Just Culture is our culture and the way we do things around here at VMH. VMH provides a consistent approach to managerial responses to human errors and behavioral choices. Our culture encompasses 3 different kinds of behaviors: human error, a slip, lapse, or mistake; at-risk behavior, choice where risk is not recognized or believed to be justified; and reckless behavior, choice to consciously disregard a significant and unjustified risk. Managers have been trained in the proper manner of responding to each type of behavior. Our culture focuses on staff behavioral choices, not just the error itself. It uses the error to fix system problems to avoid the error from being repeated. It's where staff feel comfortable speaking up about safety concerns without fear of retaliation or feeling intimidated. It holds people accountable for their behavioral choices. The workplace is free from disruptive or inappropriate behavior that doesn't follow our Vernon virtues. Next is a skit depicting people using the algorithm and helping to determine how to respond to a concern. The Wisconsin Hospital Association provided this example of a real case event that was reported at another hospital in the state. This event is not a VMH reported incident. It is for illustration purposes only. This example could have an impact on any employee in the organization, regardless which department they may work in.
Yes.
Hey, Stephanie.
Hi,
Do you have a second?
Yes, I do. Come on in.
Well, can I talk to you about a problem I'm having?
You sure can. What's going on?
All right. Well, this other department that I work with frequently, when I call them, the staff don't talk to me and they hang up on me before I'm done saying what I need to say. Can you please help me make them stop being so rude?
Okay. Well, let me talk with that department's manager, find out what's going on, and then we'll talk again.
Thank you.
The employee's manager talked with the involved manager from the other department to determine what type of process to focus on. They decided to focus on the process of respectfulness, courtesy, and self-accountability.
What things can you control in these conversations?
Well, I personally don't like calling that unit. I have my guard up. And I don't really know the staff in that area. I guess I don't introduce myself when I call. When the department supervisor walks by, I don't start the conversation first.
So what things could you change with your own behavior? What things do you completely control and could start doing differently?
I could start by introducing myself when I call and have a pleasant statement ready like, "How are you today?" I could smile and start to feel positive when I'm on the phone conversation with them. I'll try to anticipate what they need before I come so that I'm ready with whatever information they need. And when the department supervisor walks by, I'll just call her by her name and ask her how her day's going.
Within 2 weeks, things had turned around quickly for this employee. She had no more staff hanging up on her. The department supervisors started telling her stories about her family and just general small talk every time she worked. She became very aware of what a change in personal behavior can do to others' behavior. It really was a great win for everyone involved. The success in using the algorithm was shown when the tool helped identify the employee's responsibility for self-accountability of her own behaviors and actions. Her simple modifications that she made when communicating with the people in this unit made a huge impact on their relationship and changed her perception of rude interactions. Hopefully this video clip will help you understand the our culture concept in a little bit different light and how it can have an impact on every employee's experience. In the example, you can see how the algorithm works to not only explain what happened, but also understand why it happened. It promotes a process where mistakes and errors are not automatically resulting in punishment, but rather a process to uncover the source of the error. The entire basis is set up around improving systems that gives you every opportunity to succeed. Our culture focuses on looking forward, not backward. Blame is backward-looking, focusing on changing the individual. Accountability is forward-looking, seeking improvement through building stronger systems. A healthy culture looks at mistakes and near misses where every employee, every time, can stop and say, "Hey, I almost made a mistake. I need to talk about it and report it so that no one else makes that same mistake." All of us have control over building a safer and more compassionate workplace. While we can't expect perfection, we can hold each other accountable for our behavioral choices.
So today we have 6 training objectives to cover. I'm not going to read through all of these at this point in time. You can pause the video if you would like to read them, but I assure you we are going to step through each of these items. Before we do that, we have some general statements related to visitors that we would like to call out of the policy to make sure that you understand these components. The first is that visitors are not allowed to access restricted areas. Restricted areas include, but are not limited to, any area posted with signage to the effect of staff only, or with locked access. So areas containing medications, operating rooms, the caveat being if the individual is accompanied by an employee, as is done for cesarean sections, biohazardous storage areas, industrial kitchen space, private offices, etc. This is done for 2 reasons. Number 1, to ensure that our visitors are safe and that we have a safe workplace, and secondly, for privacy purposes. Visitors must be clothed and are strongly encouraged to wear footwear while in any VMH building or on VMH property. Also, we may rely on law enforcement to handle disruptive issues and/or behavior believed to be illegal as needed. We are asking that staff be prudent and judicious with the use of our law enforcement resources and only engage law enforcement when it's actually necessary for them to handle this scenario. Objective 1. So all visitors have the right to enjoy full and equal visitation privileges consistent with patient preferences. What does this mean? Patients may receive visitors of their choosing, including but not limited to a spouse, a domestic partner, including a same-sex domestic partner, another family member, or a friend. Patients may refuse to consent to a person visiting them or may withdraw consent to see a visitor at any time. And patients may also receive visits from one's attorney or clergy person at any reasonable time. Now, we included this last piece not so much for the outpatient settings, but more for the inpatient setting and the residential programs. Even if the patient's intent is to take legal action against the organization, we're not going to infringe on their constitutional right to counsel, and they would be able to meet with their attorney on premise. Also, we're not going to infringe on someone's constitutional right to exercise religious freedom, and for that reason, they may bring in any clergy or religious individual that they wish. Objective number 2. This is our opportunity to review an anti-discrimination statement. So Vernon Memorial Healthcare will not restrict, limit, or otherwise deny visitation privileges on the basis of race, color, national origin, religion, sex, gender identity, sexual orientation, and/or disability, or any other basis prohibited by federal, state, or local law. Now, these are commonly referred to collectively as protected classes, and so we cannot bar visitation on the basis of a protected class. So VMH staff will treat all patients and visitors with equality in a welcoming manner that is free from discrimination. Objective 3. Now, there are times where we may need to place reasonable restrictions or limitations on visitation. And again, we're not going to do that on the basis of those protected classes, but we may do it on the basis of some of these scenarios. So if there were a court order limiting or restraining contact, we would certainly honor that. A visitor's behavior presenting a direct risk or threat to the patient, staff, or others in the immediate environment. Visitor behavior that is disruptive to the functioning of the patient care area involved. The patient's risk of infection by the visitor's risk of infection by the patient, a patient's need for privacy or rest, the need for privacy or rest by another patient in a shared environment, any special restriction rules that apply to a special patient care area, so examples, operating suites or the behavioral health areas, and/or when visitation would otherwise interfere with the care of the patient and/or the care of other patients. These would be considered reasonable restrictions to ensure that we are able to render a safe and secure environment while supporting the clinical care of the individuals. Objective 4, this is your reminder that you were asked to review that policy. If you have any questions about the content or you would like to specifically consult a scenario and figure out how to interpret that scenario against the policy language, please reach out for a consultation. We're happy to assist with that. Objective number 5, the role of support person. So what is a support person? This is a federally defined term. It comes right out of the healthcare regulatory language. A patient support person could be a family member, friend, or other individual who supports the patient. What can the support person do? Well, obviously they can support the patient. But secondarily, they can exercise a patient's visitation rights on behalf of the patient with respect to other visitors when the patient is unable to do so. So the key statement here is when the patient is unable to do so. So if the patient is already stating preferences, the support person cannot exercise visitation privileges that would contradict the patient's preference. So if the patient says, I want to see my Aunt Matilda, and their support person isn't letting Aunt Matilda visit, that would be a contradiction of this statement. So the support person is there to exercise visitation when the patient cannot. And another key caveat is that it can be the same person, but it can also be a different individual than the individual designated on the advance directive. So if I have 2 children and I'm the patient, and I've designated one to be my healthcare power of attorney, I can designate the other to be the support person. It does not have to be the same individual. Our final objective here, we often have an opportunity to comment or ask questions about the individual accompanying our patient. And so this is an opportunity to talk about which of these statements or questions would be the most sensitive. The first, it's nice to see that your son was able to come with you. The second, do you often bring your sister to appointments? The third, and who do you have with you today? And the fourth, you look just like your mother. Obviously, the most sensitive option is option 3, because this statement doesn't make assumptions about the relationship. This statement was actually suggested by one of our patients following a handful of scenarios where the patient's relationship was stated incorrectly or was questioned incorrectly by staff who made assumptions about the relationship. So we would encourage you to use this type of statement when you're addressing patients and their visitors if you don't already know the relationship. Now, if you're family with that individual or you've been in the same congregation for 10 years and you know without a doubt that that is the person's sister, you can certainly comment on that relationship. We're just saying if you're not 100% certain, that's not territory that you want to be in. And I'd like to take this opportunity to thank you for your support of best-in-class patient visitation practices. This is simply one way that we can give so much care so close. Thank you.
Hi, I don't know if you know me. I'm Dolores Everson. I'm a licensed massage therapist at the Wellness Center that the VMH has, over on Nelson Parkway. If you've ever been out there, it's a great place. So that's where our massage therapy has gone to. We started out here in June of 2017, and then we moved out there a year ago last January. So we have 2 rooms. And there's Lydia Clark is the other massage therapist, and myself. So one of the things I wanted to point out is that our insurance company here has a great benefit that we offer for massage therapy, up to $200 a year per enrollee that they can use towards massage therapy. So being as we have our own massage therapy department here, it'd be great if our employees began to use that more than they have. And so that's kind of why we put this board together, try and encourage our employees to take advantage of that and talk about a little bit about the types of massage that we have. We have the Swedish, which is more the relaxation, does do some treatment, but it reduces pain. And then the deep tissue, prenatal, sports, muscle release therapy, and orthopedic. And we have the pricing here. And I don't know if you're aware that there's a discount as well for our employees that use our facility. So, and so one of the main topics I wanted to talk about was orthopedic massage. Might be something that you're not quite aware of. It is designed more for treatment of pain related to either repetitive use, a work type injury, or a sports type injury that may have occurred rather recently or even in the past, because oftentimes I have people come and, you know, they have something that I would say I'm treating them for with orthopedic massage, and so has something happened to you in the past, and there's, well, you know, about 10, 20 years ago, I fell off my horse, or you know, they had an accident, and I'm thinking, okay, that's what may have triggered this, and they never really had it taken care of then, and it becomes more chronic, and it kind of shows up in later years. So that's the kind of massage I do for them, and it may involve using some ice or heat or some kind of ointment, say like Biofreeze, to help with the inflammation and improve the circulation of the muscle to get it moving again. And the other thing is I like to encourage people that are pregnant women to come, because there is a lot of benefit in getting a massage while you're pregnant. The body changes so much in both physical and emotional, hormonal, that the massage can really help. It can help reduce the pain, tension, and pain that is caused by the tightening of the muscle as the baby grows, and increases your awareness, so there's better balance as the baby grows. People tend to be more clumsy, I guess you'd say, and so this kind of gives them more of a body awareness with massage. It helps reduce their stress. There's a lot of anxiety and emotional changes going on, a lot of worry probably, you know, it's just kind of a normal thing. But massage will help that person relax, and it'll help reduce their stress, and therefore also help the baby. You know, the baby senses when the mother is stressed. And so if she can be more calm, if she can get a better sleep, the baby will as well in the womb. And a study has shown that mothers that utilize this are more caring and loving towards the baby as well. And so it kind of flows into my next topic, is that after the baby's born, it's really great to learn how to give the baby a massage, because they become in tune with touch, and there's a connection. There's even a greater bond between the caregiver, the mother, the father, in giving a massage. And it has been found that this conditioning, when given repeatedly, you know, a couple times a week, or maybe more often, like during bath time or before bath time, they become automatically relaxed to the point that later on you may just have to touch them and give them a soothing massage, just, you know, a rub on the back like they were used to getting with a massage, and they'll relax more quickly. So that's a study that has proven that has happened. So if the person with the baby would stop in, I would teach them how to give the baby a massage, and probably only take 1 or 2 classes, depending upon the comfort of the parent, whether they're prepared to do it on their own, and then it's fun. You know, it'd be fun for me and have a baby to teach with, and it'd be fun for them to keep doing it at home too. So at the Wellness Center, we're, like I say, over the Nelson Parkway. You can like us on Facebook, find out what's going on there, different prices. Sometimes we run specials. And there's brochures with our pricing information. And if you happen to stop by at our table, we'll have you fill out a little questionnaire, and it would give you a coupon for $10 off of the massage.
Hi, my name's Chad. I'm a personal trainer at the Wellness Center. Today I'll be showing you yoga moves that you can perform on a chair or next to a chair. So let's begin. The first move is going to be mountain. Just place our hands to the side, core nice and tight. Take a deep breath in and let it out. We're going to warm up with some stretches. Place your hands on the back of the chair. Open up your chest. And relax. We're just going to do a side twist. Hold it for 5 to 10 seconds. coming back to center. Next, we're gonna do a yoga move called the pigeon. You can start here if that's comfortable, whatever your flexibility is. Or bring it up. Take a deep breath in and out. And in and out. So then we're going to go to warrior one pose. So we're just going to the side of the chair. We're going to take our left leg, bring it over, our right leg's coming down, bringing both arms up. Bringing them both down, recentering ourselves, switching legs, bring both arms up, and down. We'll go to warrior two. All we have to do is bring our left leg over. Our feet are pointed outward. We're bringing up our arms. We're looking to the right, keeping our core tight, concentrating on our breathing. Coming back to center. Switching legs. Toes out again, knees above ankles, core tight, shoulders back. Looking to the right, holding 5 to 10 seconds. Bring our head back, arms, and recenter ourselves. We can do plane. Once again, we bring our arms back. Then we're going to take our right foot, bring that back as well, and just hold for 5 seconds. 5, 4, 3, 2, 1. Back up, center yourself. All right, so we're gonna go into tree yoga pose. We're on the right side of the chair. We're taking our left foot. If you feel comfortable, you can bring your ankle up just like this, or you can bring your foot up a little higher below your knee. Bring your hands to your heart, or you could branch out like the tree, like a tree. It's okay to sway in the wind. That's what trees do. 5, 4, 3, 2, and 1. You can use that chair for support. All right, at this time you can relax your eyes if you'd like. Bring your hands to your heart. Take a deep breath in and out. And in and out. Bring your thumbs to your forehead. Take a deep breath in and out. And in and out. Bring your hands back to your heart. Take a really big breath in and out. I hope everybody has a great day. Thank you.
So I'm part of the Patients First team. The Patients First team is a Going for Greatness committee. It just looks at the VMH experience through the patient lens in any way that can be improved. One of the initiatives that we've been doing for a while is telephone etiquette. So you'll see here, whether it's greeting someone, putting a call on hold, transferring someone, or even a simple standard greeting. We're trying to come up with a professional and consistent way for staff to greet people on the phone, whether it's the first point of contact or whether it's getting transferred a couple times. We want that process to be as least frustrating as possible and to keep things consistent. That way VMH always is in a positive light when people think about their communication with us. Another simple way to do that would be the listening campaign. A few active listening guidelines that we can go over that are applicable in a clinical or non-clinical setting. Do not be quick to reply. Focus on what is being said. Echo back what was heard and validate what was said. We're just trying to get people to think about the way that they communicate with others. Oftentimes we hear what other people are saying, but we're not really thinking about it because we're already thinking about what we're going to say next. So using empathy and being able to listen to the message behind someone else's words, developing that shared meaning before you respond can be very effective. One of the most frequent causes of medical errors and unintentional harm in the healthcare setting is actually miscommunication. So you'll see not only can it be detrimental to accomplishing goals, but it can actually cause harm, which we obviously never want to do. Like I said, this can be applicable in a clinical or non-clinical setting. If you're in the clinical setting, you already have that patient care aspect kind of nailed down. You learned it in school. You get to practice it on a daily basis, but the rest of us might not. So being able to kind of apply that in all different facets of the organization is something that is critical. That way, people get the greeting down, whether it's on the phone, and then when they come meet with us, the communication is good no matter what. A third initiative would be the patient wayfinding. So you'll see these larger size posters around at the PSR desks and other check-in stations. And then these smaller versions that are laminated can actually be given to the patient, and these can be handed out. They will most likely be located at volunteer desks. Volunteers will hopefully be trained and shown how to use them in the next few months when we roll them out. Each map contains just a basic floor plan of the first floor. It kind of shows the main departments and areas where people are always trying to get to. So you see cardiac rehab, imaging, shows them how to get from the hospital to the MOB and vice versa. Being able to kind of show people where they're going if they're lost, or making the process kind of streamlined, that way they're not getting frustrated with wasting time, is obviously critical. If you came in and you didn't know where you were going, you'd get pretty frustrated. We don't have very good permanent signage throughout the facility, and so hopefully this can try and negate that, and these will be handed out and disseminated through the different departments, and hopefully they will work.
Hello, I am Jane Gaskell from Employee Health, and I'm going to be covering our respiratory protection standard today. So to begin with, we do have a piece of this that applies to all VMH staff. So our Cover Your Cough campaign, and the official name, of course, is the Universal Respiratory Protection, but it's known as Cover Your Cough. So as you come into any hospital entrance, the medical office building, all of our clinics, and at every patient registration area, you're going to find supplies there that we're able to offer to patients to cover their cough. So there's tissues, hand sanitizers, and surgical masks available. And we need to feel comfortable offering those to our patients or visitors that come with symptoms. And so some patients may come and it's very sporadic and infrequent that they may have a cough or sniffles. And of course it's appropriate to say, here's tissues, a reminder to use the hand sanitizer as well. But there are times when their cough symptoms are significant, and it's very important that they would put a surgical mask on. So it protects patients or other patients that are near them in the waiting room, protects other visitors, and certainly all of our staff until we know exactly what's going on with them. And so those supplies are available. You should look for those, make sure that they're adequate in your areas. We've had many influenza cases this spring, so you'll notice that. We also have pertussis and whooping cough cases at different times during the year. Sometimes we're expecting those and sometimes we're not. So make sure that you're comfortable offering this to all of our patients and visitors. So that's the piece of this standard that applies to all VMH staff. So I thank you for your time with that, and you will be able able to go into the next part of the training if we need to. The next piece of our respiratory protection program focuses on any staff that would be caring for a patient that's in airborne isolation. So we're really focusing on all providers, all of our RNs, CNAs, medical assistants, our EMTs, all of our respiratory therapists, lab staff, and our imaging staff. And some other departments may actually have to go into an isolation room, so please continue with the training so that you can have this information. All right, so there are a few pieces of our respiratory requirement. It is an OSHA standard that we have in place for you. And so obviously our TB skin testing that we do on our every other year frequency, that's part of our plan. Also a requirement from OSHA is that anyone who would wear a respirator for patient care is required to fill out a mandatory respiratory medical evaluation. And I need to have those on file and they're reviewed medically that you're able to wear a respirator. And so many of you have those on file. We'll make sure they're up to date with your health reviews. So if you haven't, you'll be receiving a reminder from me soon. And then the other piece that we're going to cover today is the respirator, the PAPR that we're using. And so we use a positive air purifying respirator, and this takes the place of the N95 mask that we used to use before. And there are many positives. So this is a higher level of protection, and we're embracing that technology. And the filter is actually 99.97% effective in filtering bacteria and viruses. Okay. So the PAPR is most likely going to be used when we're caring for a patient that we may be ruling out tuberculosis, we might be suspecting measles. Those are common things that we might see. Less likely, we might be seeing a patient with smallpox or SARS, but those are also times when we would use this. Okay. So there are many positives with the PAPR. I know people feel like they may feel like they're going to look like a robot when they come in for a patient, but there are many positives. Again, a higher level of protection. It's loose fitting, it's comfortable, there's a cool airflow. Let's see, it does provide a cooling effect. We're able to reuse these, so we're able to disinfect these. Other people can use them. We'd have less waste that way. Okay. Our eye protection is built in, so we don't have to worry about wearing eyewear as well, and people can wear glasses and not have their vision distorted. People that have a beard are able to wear these, and the best part is these do not have to be fit tested every year for every person wearing them. They're basically a one-size-fits-all. Okay. The other part that is the greatest benefit is the patient can see your entire face, so they can see your expressions, they can see you talking to them, versus when you're wearing a mask, you're completely covered. So we're taking the place of our N95 and having a higher level of protection. So there are a couple of negatives that I do want to highlight for you. We're not able to wear the PAPR in the surgery setting. So because the airflow comes below, we're not able to protect the sterile field. And so we do continue to use the N95 mask in the surgery setting, not necessarily for tuberculosis, but for other respiratory protection. The benefit of being able to recharge this and reuse this is a great thing, but we do have to make sure that that's done. They have to be recharged. They have to be ready to go when we need them. All right. So the biggest negative is just the fan noise. I'm going to turn that on so you can hear it. So it can interfere with communication with some of your patients that might be hard of hearing. It also can interfere if you're trying to use your stethoscope to listen to breath sounds or heart tones. The fan noise can be a problem. So in the emergency department, we do have an amplified stethoscope available. If we were using that somewhere, that would be available to be shared. So we're able to work around that. The other thing I like to remind people is that this can only be used for patient care. So we're not able to use this for chemical protection or fume protection. The filter is specifically made for bacteria and viruses. All right. So when we're going to be using this, you want to make sure that you check a few things. They're assembled and ready to go in most of the areas. They're all ready to just grab off the shelf and go. So you do want to make sure that your hood doesn't have any holes or tears from being stored on the shelf. Same thing with your tubing. You want to make sure that it's completely intact. And then you're going to want to make sure that your unit is working properly. And we do have a quality control for that. And so this is our bullet or a dome. Call it a floating dome. And you're always going to want to do one quality control check before you put this on. So you're going to place your floating dome here and make sure that this is bouncing. There's a designated line. Okay, so I can tell right away just by the sound of the motor when the battery's starting to run down, and what you would see is this would barely be floating and it would be making kind of a funny noise. So you'd know that something is wrong with the unit, most likely the battery. So all of those things need to be checked. The pieces just snap together very easily and you're ready to go. So now I'm going to have my assistant here, demonstrate how we would put this on. Sometimes it is easier to have a buddy place it on you. You're going to set it in the middle of your back. And once it is adjusted, it truly is a one-size-fits-all. It's easy to get on and off with one person. So you kind of have this over your shoulder, the tubing is up, and then you're going to climb into the hood. It does have a headband across your forehead that's cloth and comfortable. And it's going to go up this way. Then you're going to want to pull your headband. There you go. Perfect. And you always want to make sure that you turn it on right away. So first thing, turn it on. And it is going to be loose fitting, and the elastic goes under your chin. It doesn't go behind your ears. Does that feel comfortable, Gina? There. There. All right. Patient can see all of your face. All right, and you may feel air, you're going to feel the air escaping here, and you may feel air escaping on the outside, but it is preventing any air from the patient from coming inside, and you're only breathing filtered air. So I do want to mention a couple of troubleshooting things. As I mentioned, only for patient care, so if you would have a chemical taste or smell or a metallic taste or smell, something is either going on with the unit or in the room, and you need to come out as quickly as possible and take it off, all right? The other thing that can happen, if your battery is starting to run down, if the front of this starts to fog up or you start to feel warm in any way, you should feel cool the whole time. That probably means your battery is running down. So as quickly as you can move away from the patient, you need to come outside the isolation room, turn the PAPR off, and then you can switch that out, okay? So it's easy to get onto. It doesn't have to be fitted. It is a one-size-fits-all. For anybody who have a longer beard, we do have a hood set up that's bigger and is able to contain that as well. So always make sure to turn it on first so that it's comfortable. There we go. Thank you. I owe you. All right. Very good. All right. Very good. So this is able to be cleaned and disinfected and used again. So most often when we're working with isolation patients, we try to limit the number of people that are going in. So you may have our nurse and the CNA going in and just having this be theirs for their shift. But if somebody did need to go in, maybe respiratory therapy is going to share, we're able to use our Santa Cloth wipes, or the approved disinfectant for all of our PAPRs. So we're able to wipe out the inside, wipe out the outside with those cloths, and once that's dry, then someone else could use this. And then we are able to change out the hoods as well. And we can wipe down the whole unit that way. So less waste, works well. All right, so as far as location, we have 3 of our PAPRs in room 221, and they're available in the ante room. And employee health makes sure that every month those are charged and maintained and ready to go. We have 6 PAPRs in the emergency department, and they have 3 airborne isolation rooms now with the remodel. And so the emergency department manager and her staff make sure that those are charged and ready to go. And then each clinic has 2 PAPRs available, and the clinic nurses make sure that those are charged and available. So I do want to give you one hint on charging. We're not able to just plug these in and leave them, and wouldn't that be an easy thing to do? So they really shouldn't be plugged in for more than a week at a time, and really less than 16 hours is best. But when we have a patient on isolation, and we're going to be using this throughout their stay, it is okay to make sure that we keep them on the charger and ready to go. So my hint is that you always want to plug in your charger first before you connect it to the PAPR. The green light will come on, and then that way you make sure the charger's functioning, and then you plug it into the PAPR, and then it's able to set itself to trickle mode when it's necessary, and that way we have had much better luck with our charging process then. Okay. We talked about troubleshooting. There are other resources available. We have our respiratory protection plan. We have our TB exposure control plan. We have the PAPR training PowerPoint, and as well as just a very quick reference guide. Those are all available on MCN under the employee health folder, and they're also in the H drive under the public folders as well. Thank you for your time.